Hi, this is Dr. Upshaw, Medical Director at NeuroSpa. For those of you who don't know me, I'm a board-certified psychiatrist. I am Medical Director at NeuroSpa. We've got a few locations. NeuroSpa, we do TMS therapy. What we're here to talk about today is how NeuroSpa is helping Tampa, the Tampa Bay area, deal with the mental health aspects of this COVID-19 illness, the coronavirus. So we'll be talking about that today. First, I'd like to thank subscribers who've been watching this series that we've been doing. I actually think that these videos are going to be more and more helpful over time, and I'll kind of get to that as the mental health aspects of this coronavirus and social distancing and the COVID-19 illness really start to kind of take effect and hit a little bit more. And we'll talk about that specifically in a little bit. So if you're finding these videos helpful, we've actually also been posting informational videos answering people's questions about the coronavirus and COVID-19 mental health aspects of that. If you like the videos, please go ahead and subscribe, like the videos as you're watching them, and that's helpful to kind of get the word out so that these videos are more available to other people. So I think the best way to start is to kind of talk about what are the mental health effects of this coronavirus. And I think the short answer to that is that we don't fully understand where all of this is going from a mental health standpoint. So I'm a psychiatrist. I still see people, and I have a small private practice, but also the majority of the people I see are through our NeuroSpa clinics where people are coming to get TMS treatment for their depression. And at the beginning, people were actually handling things pretty well. People were pretty optimistic and positive about things, but I'll tell you, over the last week or two, there's been a pretty dramatic shift in the people that I've been seeing. A lot of people can't put their finger on it. They can't really describe why they're feeling a little bit worse from a mental health standpoint. There's been a lot of articles written about this in the national media by a lot of different experts about how they're quite worried that this is going to creep up on us and cause a lot of mental health problems down the line. So I think, the obvious things to talk about are things like social distancing, that we're out of our routines. People have lost their jobs. There are some very real effects that people are feeling in terms of stress, having children at home, trying to take care of elderly people, concerns about elderly people getting the virus. That there's some thoughts that they may be more susceptible, and certainly statistically they are. But beyond that, I've talked to a lot of people who still have their job. They have a pretty good situation at home. They're able to social distance, and they still can't really understand why they've been feeling worse. So I think the first thing is to just acknowledge that we're kind of in an uncharted territory here, and that we're really going to have to kind of pay attention to how this evolves and try to help people as best as we can. So, I think as psychiatrists and mental health professionals, I've been talking to a lot of different colleagues. We're not the emergency room doctors. We're not on the front lines here in terms of dealing with the physical illness. But I think that we're really going to be picking up the pieces of things as time goes on. I hope I'm wrong about that. I hope that this turns out to be something that we kind of get through pretty quickly, and the mental health effects aren't as bad as we're worried about. But I am starting to worry a little bit more at what I'm seeing the last couple of weeks. So that kind of leads me into a little bit more about what I'm seeing. I kind of touched on it a minute ago, but I've been seeing a lot of different patients in the TMS clinic, those who have done really, really well over time, and they're starting to kind of feel like sometimes their symptoms are creeping back in a little bit despite the fact that they're getting treatment. And I've seen that in private practice as well. So it's almost like the treatments that we've been using are not holding as well as we've seen in the past. Now, that doesn't mean that there aren't still people who are doing fantastic and doing well, but let's say that we have 50% go into remission, another 75% do well with treatment. Maybe those numbers are starting to be down a little bit based on the amount of stress that people are under. All right, so I'd like to kind of transition to how should you go about getting help? Really, I break this up into two categories. So if you're someone who doesn't have a mental health history, you kind of feel like you're hanging in there, but you're just more stressed than usual. If you have a mental health history, but you're in treatment and you're doing well, then I'd say I'm going to give you some tips in a few minutes. We've touched on them in some of our other videos. I'll just kind of review them briefly. And, those are the people who need to just reach out for support and do some other things like that. I think that what I'm starting to get more worried about is people who need some professional help. So there's some different ways to go about that. Obviously, TMS is a great option for people who have been struggling with depression, medications aren't working, or if they're on medications and they've suddenly stopped working. TMS treatment is covered by most major insurance plans, pretty much all major insurance plans, including Medicare. So you can call up, NeuroSpa, you can Google our name, or they've got the number and the website down there. You can call us up or contact us, and we can kind of walk you through the process to see if you're eligible to get TMS treatment. Most people, again, are eligible through their insurance. So that is one great option. If that's not an option for you for whatever reason, most psychiatrists I know are still in practice and taking new patients. They're doing telehealth sessions for patients, so that's another avenue. Psychologists, every psychologist I know is still taking new patients and seeing new patients. So, if you have a therapist that or you have a recommendation, I would get in touch with them and you can do a session over telehealth. Patients who I've been seeing have been doing great with those sessions and they've been working fine. If you don't know of a therapist or a psychiatrist and TMS may not be an option for you, you can go to psychologytoday.com, and that website, it's psychologytoday.com, and that website actually has pretty much every therapist in the area, every psychiatrist in the area. TMS, NeuroSpa TMS, we have a page on there. Pretty much all mental health providers are on that page, and you can put in your zip code, what insurance plans you have, and it'll filter out what providers are in your area, which is great because everyone has usually a profile picture. They'll have a little description of kind of what their philosophy is, and that's a really great way to kind of pick out a mental health professional for you. So again, that's www.psychologytoday.com. So that's a great resource. If you get into a crisis, there's a national crisis hotline, also called the suicide hotline, but you don't have to be suicidal to call it. If you're in crisis and you need to reach out for help, that number is 1-800-273-TALK. So that's another great resource, 1-800-273-TALK. So, I've been over some of this in my other videos, but the major things that you would notice is if you're feeling very stressed out, anxious, maybe having panic attacks, or you're feeling so depressed that you've kind of become dysfunctional, you're laying in bed all day, those are symptoms that are concerning, and you should definitely reach out to get some help for that, for some professional help. So again, you can call us. Our information's on the screen there. You can go to psychologytoday.com. You can call the crisis line. That's how to reach out and get professional help. So things that you can do at home, some important mental health tips. And again, you go to any major news outlet, there's just been tons of stories written about this. But some pretty simple things you can do. Make sure you stay off of news websites and media sites if you're stressing out and you're feeling anxious. Go ahead and get some information that you need, but don't spend all day long on those sites because, again, they're telling you the worst case scenario, as they should. That's what they're covering. You need to know about that. But if you just sit there and let your mind marinate in that all day long, that is not going to be healthy, and it's going to make your anxiety and depression worse. Make sure that you try to get a little bit of physical activity and exercise. That's becoming very, very difficult with everything being closed. It kind of reminds me of when I had young children, and on Christmas Day, everyone opens their presents and then you go out and everything's closed, even the public parks. And, where do you go to try to get some energy out or take your kids or go for a bike ride? A lot of the sidewalks and public areas are starting to be pretty crowded, so it's difficult to keep the social distancing while you exercise. So, that's important. But if you can get out early, there's been some beneficial effects shown of early morning light, getting some fresh air. You would be surprised how much that will improve your mood, even if it's just a brief 15-20 minute walk. You'd be surprised getting outside and getting some fresh air, how much that'll help you. If you can distract yourself, this is a good excuse to read a book or check out some movies that you haven't seen. Try to avoid, again, the social media, because you're going to be hearing the worst case scenario about things. If you get really worked up, try to talk to a friend. Everyone's talking about setting up the Zoom meetings, but I've had a lot of patients who've done really well with that. So that's another thing that you can do. Make sure you're focusing on things that you can control. And so I just talked to a person today who, is, still has their job, but they're really worried about what's going to happen. And, he was saying that he's trying not to get caught up in worrying about what's going to happen because there's just so much uncertainty. And to that extent, all of us are kind of living through a little bit of trauma here. And so distracting yourself from that and unplugging from that, if you're able to, is a good idea. Now, this is all strategies that are important, but doesn't even really acknowledge, that some people are really, really going through a rough time right now. Maybe have lost a job, can't afford to put food on the table, can't pay rent. I mean, or maybe have lost a loved one or has a loved one who's at risk. So there are some very, very serious things going on in society. But if you look at the statistics and the numbers, the vast majority of people are not dealing with that specific severe crisis, but they're worried about it and they have uncertainty about what's going to happen. And so that's why these very practical things can kind of get you out of your own thought patterns, distract you a little bit, and hopefully help you be able to cope with this a little bit better. So I forgot to mention at the beginning of this broadcast that we do have a special guest today. He was on the introduction thing, Jason Conley. He is one of the co-owners of NeuroSpa. And so I had so much material that I wanted to talk with you guys before I brought him on. I totally spaced it out and forgot to mention that we have him as a guest today. And we're very lucky to have him. And he's going to talk about a lot of different things. Hey, Jason, how's it going?
Hey, Dr. Upshaw, thanks for having me on.
I feel terrible that I forgot to mention you at the beginning. You must have been like, did it get cut out of the YouTube Live?
I knew you were going to get around to it, so people can't avoid me.
Okay, so I gave you a little bit of introduction, but Jason really comes from a very great business background and has brought a lot to NeuroSpa in terms of helping us really get our business running smoothly so that we can help the maximum amount of people and make sure that we're able to deliver, TMS plus the other things that NeuroSpa does in a way that is effective and consistent and is really helping a lot more people, we've noticed, since you've come on board. So I'd like to start with just asking you a little bit about what got you interested in TMS and specifically with NeuroSpa.
Yeah, no, absolutely. I come from a family that has had a wide variety of mental health issues, clinical depression being one of them. So I've always been very aware of mental health and coping strategies that are used for mental health. And I've seen some of my family members go through episodes where they've been prescribed medications that have had very adverse side effects that have been very difficult for them to deal with. They've been prescribed to one and then moved to a different one and then a different one and a different one. And it just seems like an endless hole that a lot of people end up going down. I became aware of TMS therapy a couple of years ago when a family friend of ours used it and have since done a lot of additional research into TMS therapy. When I started to look at the results of all the clinical studies that were coming out from the National TMS Society and, from different psychologists across the country and saw that, the remission rates were close to 50%, ours are actually a little higher at 55% and positive effect was around 68%, all with, little to no side effects, having the ability to get patients off of medications. It was something that I really started to take a very keen interest in. It's a very revolutionary type of mental health treatment that I somewhat see as the next wave of the first line of defense against mental health disorders. So ultimately I came across a business associate of mine who knew of this doctor up in Tampa named Dr. Nate Upshaw, and started doing some research on him and the business, and come to find out, as some of you may know, given the podcast that Dr. Upshaw did last week, I see Dr. Upshaw, although he would never admit this, as one of the premier TMS providers in the country. He's been involved in TMS for a very long time. His success rates are phenomenal. He's just overall a very good guy. We have a very close personal relationship. So when the opportunity arose for me to get involved and make an impact on a business, it made very logical sense for me to transition into helping NeuroSpa. And, I kind of look at the core ethos of our company and, what we're trying to do to expand TMS therapy in the Tampa area. And, it's very exciting. We have the ability to create a true impact on patients' lives. And, I see it day in, day out when I'm at the clinics and I'm talking to our different patients. The stories that you hear are just incredible of people who have been basically locked in their house suffering from clinical depression and, through treatment are able to somewhat get their lives back to normal, which is pretty astounding considering, the fact that, it's a non-invasive treatment and really doesn't use any type of medication. So it was a very natural progression into the business and something that myself, I know Dr. Upshaw and the rest of the executive team are very excited about.
Yeah, I think that, obviously you coming on board has helped us really kind of stabilize the business and has allowed us to offer TMS to a lot more people, which has been great. And then all of a sudden this COVID-19 thing hits, right? And we're sitting here thinking about what are the mental health consequences of this. Like we talked about before, we don't really even know the full consequences yet. But we start thinking, what can we do to help in the community to try to increase the awareness about mental health issues and to try to help in some way for people who are struggling and suffering. But first, we had to decide whether or if we could even stay open. So from a business standpoint, can you talk a little bit about what went into, the decisions and the challenges with that as this kind of started to unfold?
Yeah, absolutely. So, I don't know if you remember this, Dr. Upshaw, but back in January, when we were meeting in person and touring the clinics, we started seeing these videos out of Wuhan of these big disinfecting trucks that were driving down the main streets of Wuhan, spraying disinfectant over the streets. This was back in January. I remember some of our dinner time conversation, after working, and we started to think, wow, this is a serious problem that China is faced with right now in containing this. And then next, over the course of the next, call it 30 days, we saw that transition away from Wuhan and start to spread to Europe and to other Asian countries. And that's when, in middle of February, you and I had a conversation to say, there's a very solid chance that we're going to start to see an outbreak here domestically. What can we do to better position our business in order to avoid circumstances where, we're putting either our employees at risk and or our patients at risk? And then, come March 1st, you started to see domestic cases rise. And that's right around the time when you and I worked together to implement some of our policies and procedures in order to really protect our employees and our patients. Once the middle of March evolved, we were well positioned to stay open. We had policies and procedures in place to make sure that everybody was staying safe in the clinic. But then, obviously the cities and the state governments decided to impose lockdowns, which, in our opinion was a very smart move. But, our business has always been viewed as a critical health service. So, we are on the front lines of mental health. We are helping patients that are dealing with very debilitating disease. And luckily, the government recognized the fact that this treatment is a necessity for a large portion of our patient base, if not all of our patient base. And it's very critical that we have the ability to stay open during these times in order to help our patients. On top of that, there was a very burning desire company-wide, going all the way down to the treaters that our patients interact with on a daily basis, to stay open and to provide treatment to these patients because they see how patients are in their first treatment and they see the positive progression through treatment. So, there was a big push from our employees to stay open as well, to continue to offer this treatment to our patients. So, thankfully we were able to stay open and provide that care that was needed.
So yeah, I think that that's been the really the coolest thing from my standpoint, working with someone with your business experience, is that basically I can stay up to date. I'm an active member in the Clinical TMS Society. Back, I think it was the end of February, early March, there was a national grand rounds online about TMS clinics and what we should do to protect our patients and the providers. And all I have to do is say, hey, this is what we need to do, and then boom, you're able to kind of roll that out company wide, put it in place. And I really feel like, us working together, we've really been out in front of all of this in terms of safety, in terms of disinfecting, wearing masks, social distancing. We've been out in front of all that, and I'm pretty happy to say, knock on wood, we've been able to keep all of our employees and patients safe, and our clinics open. In fact, Rachel asked a question: are you guys still seeing as many patients right now with the coronavirus? And pretty much yes, we're still seeing the same amount of people come in. And as a psychiatrist, I've been kind of surprised by that I have an honest conversation with each patient about the risks of being out and about versus the benefits of the treatment, and pretty much everyone wants to stay in treatment because it's helping and is benefiting them. So it's been up to us to make sure that we provide a safe environment for them to get treatment, and I think we've been really successful with that, thanks to your help and the team's help in terms of keeping all of that together. So it's been really
Oh,
good.
absolutely. Look, a lot of it has fallen on your shoulders as well, so I appreciate all the help on your end too. I think that what we've experienced has been that there was kind of this phase in March where we saw patients somewhat go on hold because they felt like, look, we're in it for a 2-week lockdown. Let me just put my treatments aside for 2 weeks, and then when things open back up, I'll resume my treatment. What we've seen now that we're almost 30 days or past 30 days into this lockdown is that patients realize, this is not a 2-week thing where I can postpone the need for my treatment. And we're seeing a very strong resurgence of our patients back into our clinics. And then on top of that, we've seen a lot of new activity. I think that the mental health implications that this has imposed on society are vast. I mean, it is, as you mentioned in the earlier part of this YouTube, it's going to take a while for society to adjust to all these changes. And, the mental health aspects are very closely tied to all of that as well. So we've seen kind of a resurgence in new patient activity as well, in patients that are struggling with mental health issues that we've been able to help. And, like you had mentioned too, we've kind of been at the forefront of making sure that we're keeping our employees, who we value very much so like family, and our patients as well, as safe as possible. So, making sure that we're doing regular disinfecting, making sure that we're having no contact in between the patient and the treater, making sure that all of our treaters are wearing masks and gloves, wiping down all surfaces in between treatments, and then also limiting the amount of people in the clinics. We've had a portion of our staff who is working at home that is able to work from home, to limit the amount of bodies that we have in the clinics. And then with the patients, should there ever be a wait, which is very rare since typically we don't have a ton of patients in the clinic at any one time, we've encouraged them to stay in their cars until they have the ability to go straight into a treatment room and receive treatment, so that, we're maintaining all of the social distancing standards as well. So we've taken a lot of precautions, and we are seeing a big number of our patients return. we're seeing a lot of new patients as well. Thankfully, we're in a position to be able to help them.
Yeah, and from our standpoint, our goal is to make it so basically the patient can walk in without touching anything, sit down in the chair, and be more than 6 feet away from any person, um, pretty much the whole time that they're in the clinic. So we feel really good about the safety protocols that we're following. So I wanna ask you, because the topic of this YouTube live was what the plans are for NeuroSpa to kind of get involved in the Tampa Bay community as this kind of the mental health issues kind of unfold over the next few weeks and months. So just if you could just talk about what we're doing to kind of connect with the community and try to help out.
Absolutely. From a business owner perspective, navigating these times has been challenging. Traditionally, the ethos of our company is to really get the word out there about this type of treatment and to try and help as many people as we possibly can. Obviously, the landscape has changed a little bit, but I'd say a lot of this really falls to you, Nate, and we're very grateful for all of the effort and time and energy that you put into this. But doing these YouTube lives and content generation to put out there and get good, solid content out to the community on how they can deal with their depression and anxiety is kind of the biggest push that we've had. In addition, making sure that we're spreading the word continuously on news forums. We've started to co-host some podcasts with some influential people in town as well to try and get the word out. So a lot of our community outreach basically rests on us getting mental health awareness out to the community. And then, on top of that, letting them know that there's an alternative therapy that they can use to treat whatever issues they may be faced with. And like I said, a large portion of that effort has been on your shoulders, Dr. Upshaw, and hopefully the community understands the time and the energy and effort that you put behind it to try and just create awareness and somewhat take the taboo out of this, because so many people are faced with these issues, and it's really not a taboo type subject. But there just needs to be a better effort to create very solid content so that communities are educated and aware of how to deal with it, because I think a lot of people still that are faced with this mental health challenge don't know how to deal with it. Our primary method has been just doing whatever we can to spread the word about mental health and treatment to the community.
Yeah. All right. So I think that kind of wraps up what we had to talk about today, but I wanted to do the quick little game show thing with you here that we're doing with all the guests that we have on YouTube Live. Are you ready?
One last thing. Let me just say thank you very much to all of our employees, who continue to show up on a daily basis. I know how challenging it has been. Our employees are faced with spouses that have been let go, family members that have been infected, that obviously they're not in direct contact with, but that have faced these health issues. Having to deal with childcare. Our employees are on the front lines, and we're so grateful for all of the effort and energy that they continue to put into the community and into helping our patients. So I just want to put a big thank you out to them.
Yeah, TMS wouldn't work without them, because the patients, when they come in for treatment, they really connect with the people that they see every day, and that's a really important part of the treatment. Actually, is your interaction with the person giving you treatment every day. So I agree with you 100% there. I'm glad that you mentioned that. That's good.
All right, let's get ready.
All yes. Right. What's one thing you're grateful for in this moment of quarantine?
I think it's just being able to spend a little bit of time off the road and spend some good quality time with my family. I know I hear the TV in the background in the family room, and I'm sure that my son's watching, and just being able to even have lunch at the kitchen table, and or have him come in and barge into the office when I'm on a conference call. It's those little moments that we'll cherish, and the time with family has definitely been the the most positive aspect of the quarantine for me.
Yeah, that's been if there's any silver lining in this, the ability to marinate with the family a little bit is really something that is potentially potentially positive for
Absolutely.
most people. All right, ready? Number two, tell us about something you've tried that's new this quarantine.
Oh man, I don't know that I've tried much that's new. I'm certainly doing a lot of cooking. We're not eating out at all, and disinfecting of all the groceries. Can't say that I'm trying much new. Working from home has been a little bit of an adjustment as well. But just finding a good, healthy balance to life has been very important to me maintaining my sanity. So I would say just trying new things in order to maintain that balance would probably be the new thing that I've tried.
Awesome. And then what's the first thing you're gonna do once the stay-at-home orders are lifted?
Yeah, I think the first thing that I'll do is probably try and do some sort of dinner date with my wife. We haven't gotten nearly enough quality time together, and having the ability to do that once life somewhat resumes back to normal is going to be great.
I thought you were gonna say come to Tampa for the hot
Well,
chicken
that's a given. That's a
at,
given.
at our favorite restaurant up here when you come into town. The hot chicken, man.
Absolutely.
All right. All right. Well,
That's
thanks
right.
again for joining us and kind of sharing your insights from the business standpoint and kind of letting everyone know what NeuroSpa is doing to kind of help do our part to help out mental health in Tampa. And I'll tell you, this is something we're going to try to continue to, work on, and it's going to evolve because, again, as a mental health professional, we don't even really know where this is going. So we're going to keep our finger on the pulse and really try to help out where we can.
Absolutely.
So, all right. So I'm gonna let you run, and then I'm gonna see if I got any couple questions, and then we'll kind of wrap things up. So thanks again, Jason.
Thank you.
All right. Take care. Okay, so I got a couple of questions here. We're gonna do a little question and answer. Remember, anytime you guys want to send something in, I can answer it at the end of these sessions. Lauren asked, "Can I start TMS now?" And the answer is possibly, probably. All you have to do is just go to our website. You can send a contact form in this evening with your info, and someone will contact you tomorrow and walk you through and see if you're qualified for the treatment, and they'll do a consultation with you. And you can also call our phone number tomorrow. So that's great. Christina asks, "Am I allowed to walk in the street?" I guess you're able to walk in the street if there's no cars. I think that the most important thing about being out and about is that you maintain that 6 foot distance with other people. And then obviously there's a lot of things that are closed, so make sure you don't get yourself into trouble like supposedly Tom Brady, our new neighbor here in Tampa, had some issues at a park recently downtown where he was trying to do a workout and they came to tell him it was closed. Um, um, uh, Antony, I think, said, "Thanks for being live again. Too much news makes it scary." That is 100% true. I've said before, I've noticed myself when I watch more than about 30 minutes of news, I start to get down. I start to get more worried than, I should be. I'm obviously worried about what's going to happen. I'm trying to take precautions. But other than that, that's not something else I can control. And so unless something specifically happens that should change what I'm doing, worrying about it isn't helping. So I've got another question here. How successful is TMS in comparison to other depression treatments? Well, this has actually been very well studied. So if you look at someone who's depressed and is looking at getting psychotherapy or taking medications, so TMS would be kind of an alternative to taking medications, or someone who's on medications, it'd be something else for them to try that works, directly on the body and the neurochemistry. And so what we find is that an antidepressant typically has about a 60% chance of helping and about a 40% chance of leading to remission. However, once you've tried an antidepressant, the chance that the second antidepressant is going to work is actually going to go down, and the chance that the third one is going to work is going to go down even further. This was actually studied in a famous trial called the STAR-D trial, where they tested people with an antidepressant, and if they failed it, they tried another one, and then another one, and another one. And so after you try one antidepressant, the chances that the second one is going to work is actually much, much less than trying TMS. So I tell people, if you've tried a few antidepressants and they're not working, then TMS really is the next thing to try. The data suggests that you don't really need to try any antidepressants. If you're depressed, TMS on paper should work just as well or better than a medication and potentially has much less side effects. So that's the answer to that. So Laura asks, do you prescribe prescription medication with the TMS or just the TMS alone? So TMS works well enough for the majority of people who come into the clinic that's all we need to do in the clinic. We also do some other things in terms of giving you information, things like that. I am a board certified psychiatrist. I can prescribe medicine, and to be honest, most of the people who come and see us are still on a medication when they start TMS. So I usually work with their psychiatrists or their primary care doctors to adjust the medication during treatment, because most people end up on less medications as they go through treatment. Some people are even able to get off of their medications. But the majority of people in TMS are improving with TMS. So the best way to think about it is if you're on Prozac and you're going to switch to a different antidepressant, then the best thing to do is to try TMS next. And you got to give TMS a chance like you would an antidepressant. Luckily, it works pretty well for people. They start to notice the improvement, and they're actually able to reduce the amount of medications. So the short answer is yes, if we need to prescribe a medication, we can, but it's usually unnecessary because TMS itself is usually a superior treatment choice, especially if someone's tried a couple different medications. So Laura also asks, how does it work with social distancing? So what we do in our clinic is that you're able to come into the clinic and you're not going to be within 6 feet of anyone as you come into the clinic, go through the waiting room, and go and sit in the TMS chair. Once you sit in the TMS chair, the technician or the treater, they have a mask on, you have a mask on, the treater has gloves on. They're going to be, within a foot or two of you while they place the magnet. They're in your little space for about 30 seconds. And after that, they're not near you. So really, you're able to keep that 6 feet. You have a mask on, they have a mask on. We're also screening all of our patients and all our employees for any symptoms at all. And so let's say a patient wakes up with a headache, or they have a sore throat or a stuffy nose. They will call us and let us know, and they will skip treatment, and they will be symptom-free before they come back. Obviously, if they end up with a COVID test or a positive COVID, there's all these different CDC guidelines we follow. But we are only treating healthy people in the clinic. Now, as you know, there is some asymptomatic transmission with this COVID-19. We haven't figured it all out, but we do know that the mask, if everyone is wearing a mask, the chance that you're going to get that transmission goes way down, because you're breathing into your mask, they're breathing into their mask. So again, I like to tell people that coming into our clinic for treatment is probably one of the safest things that you can do out of the house, safer than going to Publix or the store, safer than going to Walgreens, maybe it's safer than taking a walk on the sidewalk where you're passing people. So obviously, if you are at home and completely quarantined, that's the safest thing. But coming to the TMS clinic for treatment, it's pretty darn safe in terms of the way that we're doing it. So that's how it works with social distancing. You will be able to keep your distance from people. All right, so that looks like that's kind of wrapping up for the questions tonight. Thanks for everyone for joining again. If you find that these videos are helpful, please subscribe to our channel. Please stay tuned with us as things change. I'll tell you, the last week or so has been a drastic change than the week or two before that. I'm staying up to date on the medical literature, both from the virus standpoint of health and safety, but also from a mental health standpoint. I'm in touch with all my colleagues, and we're really going to work hard on bringing you the most up-to-date information about how COVID-19 is affecting mental health, and obviously NeuroSpa is going to be involved in trying to help out in the community as much as we can. So thanks again for joining, and have a good night, everyone.